All right, we are live. Just want to do a quick sound check for everyone. If you can hear me, go ahead and give us a thumbs up or a happy face smiley. All right, got one thumbs up. Thank you. Any other thumbs up? And Marissa, you can hear me too, right?
Yes, I can hear you.
Perfect. And go ahead and keep talking. Everyone else can hear both myself and Marissa, correct? Keep giving us thumbs up. All right. Got a lot of happy faces.
That's a good sign.
Yeah, that is a good sign. Good, there we go. We got another thumbs up. All right, so we'll start in about a minute or so. Let some last minute stragglers come in. Got a few people calling in. All right. Perfect. So for those of you tuning in, we are recording the webinar. So if you have to cut out early or you get disconnected, don't worry. We'll email you a recording of everything. But both Marissa and I will be giving you guys a very cool offer at the end of our presentations. So you definitely want to take advantage of that if you're interested in either of our services. So be sure to at least stay till the end of the presentation or at least watch the recording that we send you right away. Okay. Perfect. All right, and see most of you see the chat box is working pretty well. So what we're going to do is, if anybody has questions during the webinar, you can see there's an option if you're on a computer for an attendee chat. And I'm going to type a quick message here from me. If any questions come up, go ahead and type them into that chat box. At the very end, we're going to have 10 minutes to kind of answer questions that might come up for either Marissa or myself. And let's see, so we're 6:34. All right, let's go ahead and officially get started. So thank you for everyone for joining us on this Tuesday evening. I'm sure everyone's had a pretty long, hectic day. I know I had a long, hectic day, just finally wrapping up, and excited for all of you guys to be here. Marissa, you want to say hi to everyone?
Hi, everyone. Thank you for joining us for this exciting webinar.
First of a kind, I think. I haven't seen anybody do something like this, and I think what we do really complements each other. So I'll give you guys a little background. Marissa and I met maybe about 3 years ago when we first opened our businesses. We were sharing basically an office space, and we were renting the rooms that were right next to each other. And we started chatting. We had lunch, and Marissa started chatting to me about how there's this whole movement in skincare and skin health about how the foods you eat matter, the way you hydrate, and all these other things. The state of your gut health influences the health of your skin. And in my world, that's what we do. But I never realized the correlation to skin health and clean, vibrant, flawless looking skin. And so I put this webinar together to really explain how this system works, why it's so important, and why working with a practitioner like myself and Marissa together can sometimes yield some really awesome results for very difficult skin issues. And Marissa and I have worked on quite a few cases together. I referred a lot of business to her, and she to me likewise. And it's really because I know she's great. She's very passionate about what she does, and she's very good at what she does. So there's our details there. Let's jump into it. I'm going to start with my presentation about 20 minutes. Merissa will follow with her 20 minutes, and then we'll leave the end for any questions that might come up. So here we go. So a quick intro about me for those of you who don't know me. My name is Dr. Ernesto Medina. I run a functional medicine and neurology practice in Campbell. Do a lot of personalized blood testing, looking for underlying causes of chronic illness, chronic disease, inflammation, and things like that. Let's get into it here. So I want to give you guys a little background because Merissa and I both talk a lot about how we have struggles where clients and patients going through the conventional system um, don't really get very good quality care, whether it be for skin issues, for health issues, hormone imbalances, thyroid issues, whatever it may be. Um, they get the standard of care, which is often not going above and beyond for that individual. And so, as far as kind of these chronic skin issues that come up, the conventional model, which would fall under dermatology usually, um, they all get categorized and treated almost the same way, which is kind of sad. So I did a little research, and according to the Mayo Clinic, which is, if you guys don't know who the Mayo Clinic is, they're a nonprofit research and integrative clinical hospital, and they put out a lot of great information. And as far as their definition of what causes things like acne, there's four main reasons, and they say excess oil production of the skin, clogged hair follicles, bacteria, and high androgens or high testosterone levels, especially in women. And factors that worsen acne, they list as oral contraceptives, and they even list diet. And they do list dairy and carbohydrate rich foods and even chocolate. But it's rare, and Merissa could probably attest to this, it's rare that we hear dermatologists actually educate their clients that they need to make some dietary changes to improve their skin health. And that's something we believe is a big contributing factor to inflammation and even excess oil production of the skin, the internal system. And so, because of their understanding that that's what caused the skin issues, their treatments almost always revolve around the same three things. And they are either antibiotics, taken either orally or like a topical antibiotic cream, topical steroids, so anti inflammatory steroid creams used, or they'll prescribe you birth control to help with quote unquote hormonal acne, that they call it. And as we saw on the previous slide, birth control or contraceptive use can actually contribute to worsening skin issues. Okay. Now, let's see here. So, my three secrets to flawless skin, first is going to be that the skin is an organ of detoxification. So remember, we mentioned gut health being important to skin health. And why is that? And really, the digestive tract is a system of detoxification, and so is the skin. So it makes sense that if our external skin, which is our external organ of detoxification, is bad, there's a high probability our internal digestive system is also bad. And so if we break down the internal organs of detoxification, they are liver, the gallbladder, the intestines, and more specifically, the bacteria in the intestines, our microbiome, the kidneys, the lungs through inhalation and exhalation, and then the skin. Okay. Now, if you Google organs of detoxification, basically they're just going to say liver. But there's a much deeper understanding here that the liver and the gallbladder function as a unit, but if there's an issue, you can have issue in one or the other or both, and they have to be addressed differently. And then same thing with the gut and the intestines. They are also an organ of detoxification. If you imagine bowel movements and having regular bowel movements being so important to get rid of toxins in our system and waste in our system, if someone's not having regular bowel movements, that's going to back up into the system and affect the immune tolerance, going to affect liver and gallbladder and overall digestion. Okay, so again, this concept is super easy, but I want you guys to understand, if the internal detoxification system is not working properly, it's going to express itself. It can express itself also in the skin externally. Okay, now secret number 2 that I have for you guys is, we start with a question. What would you guys guess damages or impedes the organs of detoxification? Right? And specifically the internal organs of detoxification. What do you guys think? If you guys want to offer a guess in the chat box, I'll give you 30 seconds to type something in there. But we've already kind of touched a little bit about certain foods, like high carbohydrate foods, chocolate. We got a couple guesses in the chat box. Yeah, we have inflammation, definitely. The foods we eat, definitely. And so let's get into it here. So even stepping away from that, the same treatments that are commonly used in dermatology to address some of these topical skin issues are the same things that can damage and impede our internal organs of detoxification. The irony, right? So antibiotics are notorious for just killing off the good bacteria in our digestive tracts, right? But I know many women who suffer with skin issues are put on antibiotics and are on them for years and years and years to try to control their skin issues, from acne to rosacea to any kind of inflammatory, red, irritating skin issues. They'll put them on antibiotics. And long-term use of antibiotics is known to destroy the digestive tract. Topical steroid creams also affect the lining of the intestines and can affect the liver. And birth control. Birth control especially impedes the liver's capacity to detoxify. And if you're on birth control for long periods of time, many years, it definitely is going to slow down your liver's efficiency at detoxifying. And then an inflammatory diet. Um, Big contributors of the inflammatory diet, the things we already discussed, but there are many more that we're going to touch on a little bit towards the end. Okay. So birth control, let's talk a little bit about birth control, because I know Merissa and I have spoken a lot about this and we're on the same page. I have seen women on oral or different types of birth control for every single thing diagnosable except actual birth control. I've seen women on it for acne, for irregular cycles, for migraines, for PMS, for depression, for menstrual cramps, for perimenopause, and the list goes on and on and on. And what's happening is they're addressing a hormonal imbalance with more hormones, which doesn't make a lot of sense when you really think about it and know the biochemistry behind it, right? If you have an underlying issue, you mask it with birth control. When you come off that birth control, guess what? All those problems, all those symptoms that you had are going to come back. And your risk for infertility greatly increases with birth control. Okay. Now, there are different types. There's oral, there's IUDs and things like that. I'm not going to get into depth on that, but they all affect the system a little differently. And some people do well with some and not with others. Right? But it's a big pet peeve of mine when I see women on birth control for everything except for actual birth control, right? There's an underlying issue causing the symptoms. They're never investigated into and addressed. And just masking it with the medication doesn't do much for you as soon as you come off of it. Okay. Now, secret number 3 that I have for you guys is food sensitivities contributing to inflammatory diet. Now, food sensitivities are different from food allergies. Okay. This is very important for everyone to understand. Food allergies happen almost immediately, and they can be dangerous, like anaphylactic shock and things like that. From when kids eat peanuts or something like that, and they swell up, their eyes swell shut, or their throat swells shut. Very dangerous. This is not a food allergy. I'm talking about food sensitivities. And these food sensitivities, basically a person reacts to, but they react to sometimes days after they get exposed to it. And it causes a chronic low grade inflammation in the system that keeps building up, building up, and building up over time. And then eventually, someone starts to experience health issues from that chronic inflammation from the food sensitivities they have. Now, these are very difficult to pinpoint and diagnose because the foods differ from person to person and the symptoms differ from person to person. So they're almost always unique to the individual, and it can be anything. So the solution to this is one way is specific blood testing. And I can tell you, allergists, if you go see an allergist, they're not testing you for food sensitivities. They're testing you for food allergies. They do not believe that food sensitivities exist, and so they deny testing appropriately for food sensitivities. I've had this struggle for years now with patients who come back and tell me, I got tested for food allergies and I don't have any. And I look at their test results and they didn't even test the right things. They didn't test for sensitivities. And so the way that's done is through a very specific lab called Cyrex Labs. Okay, I have access to this testing. Anybody who's interested in it can contact me and get more information. But believe it or not, most of the time I don't actually order this test because it's pretty expensive. It's like $600, and it only tests for about 180 different foods. If you're eating something outside of those 180 foods that you're reacting to, we're never going to know. And so, what the more cost-effective solution I use is actually a 5-week food elimination diet. And so what we do is we give you a list of highly inflammatory foods and we have you eliminate all those foods for 5 weeks. And really, you're just eating vegetables and protein and sweet potato, right? That's pretty much it for the 5 weeks. And we have a whole detailed program and a handout that we walk patients through to do this. But at the end of the 5 weeks, you introduce one of those inflammatory foods at a time. Essentially, what happens is your system sensitizes during those 5 weeks of not having those foods. And if any of those foods is going to cause an issue for you, it causes it almost immediately. And so that gives us a more accurate window of what foods are causing you issues and which ones are not. Right? It doesn't mean you're going to react to all those inflammatory foods, but it's really great to know what things in your regular diet may be contributing to your issues. All right. All right, so I want to share a couple case studies with you just to wrap up here. And so I really got super intrigued into working with skin conditions in my office just within the last maybe 3-4 months. I had 2 different cases of women, young women, who came in with really rare skin issues. And they were working with a dermatologist. They struggled to get an accurate diagnosis. When they finally got the diagnosis, the treatment was, guess what? Topical steroid cream, right? Just like everything else that we mentioned before. It's either going to be oral topical antibiotics, topical steroid cream, or birth control. And so they had been prescribed a topical steroid cream, which wasn't really helping. It was helping a little bit, but not really. But they didn't want to become dependent on the medication. And so they were referred to my office. And the first case here was a young woman. She had been diagnosed with lichen planus, and I had no idea what it was. I had to do research on it, and when I met with her, I told her, I don't know if we're going to be able to help you. But when I did research on it, this is what came up, and this is also from the Mayo Clinic. Basically, unknown cause. They suspect it is due to overactive immune response to the skin. They've identified a couple potential triggers being hepatitis C, the flu vaccine, chemicals, pigments, and metals. And of course, the treatment was a topical steroid cream. Now, this woman actually, her lichen planus flared up after going to a wedding and getting a henna tattoo done. And after she had the henna put on, days later, her skin flared up, and it had been that way for 3 or 4 months before she came into my office. And so it wasn't getting much better. She was super frustrated. And so when I did the research and found out it was possibly immune related, I thought, man, okay, so we can definitely do this. Most issues that come into my office that have an immune component or an autoimmune disease, we definitely have to look at the organs of detoxification, and we definitely have to look at environmental triggers, especially foods. So I told her, give me 5 weeks, follow my program, and we'll see how much improvement we can make. We did run some initial blood tests on her to see if there was anything else going on, and then we got her started. And this is a picture of what it looks like on the side here. Let me see. Oh, let me go back. So I'll give you a little bit more. So within the 5 weeks, she was very strict with the diet. She identified about 3 different triggers that she had. One of them was vinegar. So she was doing dressings. She was doing salad dressings with like a red wine vinegar, and the vinegar was really flaring her up a lot. What else? I believe white wine was also another big trigger for her. We think it was partially the sugars in the white wine, but we're not 100% sure. But it was definitely a big trigger for her. And so we cut all those. She identified them through the program. She was really good about cutting them out. While she was doing that, I had her on supplements to help rebuild and support her digestive tract and her immune system, along with her liver. And by the end of the 5 week program, her skin was about 95% improved. And that was without the topical steroid cream anymore. That was just with the foods and repairing her detox system in her digestive tract. So she was super excited, and she continues to be my patient. We're working through other things, but she has not had any flare ups since then. And it's been about 5 months, 5 or 6 months now. So that was pretty exciting. And now this other case here, just to wrap up in 2 minutes, this was another pretty much the same situation. She had been diagnosed with lichen sclerosis, and it took her multiple dermatologists to finally get a diagnosis because they had no idea what she had. Again, I looked it up in the Mayo Clinic. Unknown cause. Again, they suspect it's due to overactive immune response to the skin. Potential triggers are unknown, so they had no idea what could be contributing to this. And again, she was prescribed a topical steroid cream. So again, I told her the same thing, same situation, ran some blood work. In her case, though, one of the other big issues she had before starting was she had really debilitating bloating of her stomach. So she had a bacterial issue in her digestive tract already that was causing very bad indigestion and bloating. And so we right away, I knew there was an issue in the digestive tract. We ran some blood tests on her. She ended up having something called SIBO, which is small intestinal bacterial overgrowth. We worked at killing that off with some plant-based antimicrobial supplements. We killed it all off. We rebuilt her digestive tract, her organs of detoxification. Again, we did the food elimination program. And within 3 weeks, her symptoms, actually her skin completely cleared up. I was amazed at how quickly it cleared up. And what's unique about this is lichen sclerosis typically is always found around the genitals. And so it makes it, if it flares up really bad, it makes it really frustrating and painful to have this constantly, and especially when medications aren't really addressing the issue. All right, so to close, before Merissa starts her presentation, my offer for everyone tuning in here is I am offering a free 30-minute consultation, which has a value of $150, offering it for free if you're interested in learning more about the services I offer, but you must sign up today. So all you have to do is send a text to this number right here, 408-755-5710. And this will be listed in the email I send you with the recording of the webinar. But if you send a text today to this number with your name, we'll reserve you the spot and we'll get in touch with you to get you scheduled. Okay. And again, my name is Dr. Ernesto Medina. Bay Area Health and Wellness Center is my office in Campbell. There's my website at the bottom and my Instagram handle there. All right, let me check if there's, all right, perfect. So I'm going to switch the presentations over to Merissa, and then she's going to give you guys all kinds of awesome information. All right. Oops, we have slide 2. There we go. Slide 1. All right, you're up, Marissa.
Thank you. Well, welcome everybody, and thank you for joining us for this webinar. My name is Merissa Rodriguez, and I am the owner and esthetician of Seeing Beauty Skincare Studio. I'm just a little bit of a ways down in Campbell, on Campbell Avenue from Dr. Medina. So I'm going to go ahead and go over different things that contribute to our overall skin health, our lifestyle, and the choices of that being one of them, anti-aging factors, things that contribute to aging, the aging in our skin, and an ideal skincare regimen. So lifestyle being one of them, we live in a fast-paced world, especially in Silicon Valley. I feel like we're always on the go, and different things that we don't sometimes realize that, we're going through or that we deal with on a day-to-day basis can have an impact on our skin. One of those being sun and sun exposure. So melanin is a pigment found in the skin which can protect us against UV rays to an extent, right? So we have to take into consideration our jobs. Do we work outside? Are we runners? Do we run outside? Do we work in an office and sit by a window? Do we commute regularly? Things like that. So our skin color is typically is there's a Fitzpatrick scale that has from 1 to 5. 1 being would be your lighter European skin, and 5 would be your darker skin. So it can protect you from UV protection to an extent, right? So the closer we are to the equator, the darker our skin usually is, to protect us against the UVA and UVB rays, right? It doesn't necessarily mean that the darker your skin is that you will not burn, because there is still a possibility that that might happen. So avoiding unnecessary skin exposure would be ideal. The top right picture is a gentleman who is or was a truck driver, and his left side of his face obviously shows a lot of sun damage and aging due to the UVA and UVB rays going through that window as he's driving, not wearing sunscreen. So being really mindful of that, even if you're picking up your kids from school and driving, or just running back and forth from your car. One thing that I hear a lot from my clients is, they don't feel they don't feel that it's necessary to wear sunscreen because they have a desk job and they're inside most of the time. Which, if you're protecting yourself, that's great, and you're inside and, you don't have regular exposure to the sun, that's okay. But still wearing that SPF, I'd say 15 to 30 before you leave the house is really beneficial, because we're exposed to it at different points in the day. The bottom right photo shows how the sun can penetrate through the skin when you're not wearing sunscreen versus an SPF of 15 and 30. If you do have regular exposure to the sun, you're definitely going to want to reapply the sunscreen throughout the day. There are many ways to do that and not mess up your makeup for the ladies. Powder forms, sprays, things like that, which your esthetician or I can help you find one that best suits you. Another one would be your foods. Like Dr. Medina had touched on a little bit. What you eat can affect your skin and will affect your skin. It's kind of like healing your skin from the inside out, right? So, eating to support your skin health, balancing your essential fatty acids, your omega 3s to your 6s. And typically, like the American diet, we have more 6s than we do 3s when it should be the other way around. Making sure you're getting your green leafy vegetables, your walnuts, your chia seeds, your lean meats, versus, your carbs and your red meats and, all the things that can make our soul feel good, but not necessarily our bodies. Also, supplementing with foods to support our immune system with antioxidants to fight against free radical damage, and just improve the overall health and wellness of our skin and bodies. So, smoking would be a big no no, right? And we tend to see a lot of premature aging with people who are heavy smokers because smoking does deplete the skin from the oxygen, which reduces the blood flow, leaving your skin dull. And it also takes nutrients from your skin, including vitamin C, which would help fight against free radical and free radical damage. So stress. Stress is something that we can't always control, right? But it does cause a chemical reaction in your body, which can aggravate things like rosacea, acne, eczema, and psoriasis. I myself know that sometimes, we don't always know when we're under stress. Like, I mean, a truck can go through our house and we go through the day and we're just like, all right, we're doing this. Like, and then you're trying to figure out why you're breaking out or why your rosacea has flared up. And then you realize, oh, yeah, like I'm going through some stuff. So to just be mindful of that, and we might not always be able to control what happens in our life, but taking time for ourselves to relax, whether that be exercising, doing yoga, going for a walk, telling the kids to go to another room while you have some quiet time, whatever that may be, just to help with your overall well being. So next I'm gonna go into aging skin. It's something that we all don't necessarily want to happen, or to age as gracefully as possible. Uh, so there are different types of skin aging. We have our intrinsic aging and our extrinsic aging. So our intrinsic aging would be things that we cannot control, like our DNA, just life itself. As much as we try to find the fountain of youth, we might not be able to. And then your extrinsic would be things that you can more or less control, or things that we put into our body that we choose to do to an extent, right? So extrinsic aging could be things like lifestyle, like I had went over in the previous slides. So we're talking about what we put in our body, our stress, our habits, alcohol, drinking, I'm sorry, smoking, our stress topics, and then nutritional deficiencies, like deficient in vitamins or even hormonal, which we might not necessarily know that we're deficient in those things. But I'm sure Dr. Medina would be able to help you figure out if you are and where you're deficient. I know that we have worked together with a few clients, and things that you would have no idea you were deficient in something, and it just completely gives your skin a 180, whether that be with acne or the elasticity in your skin or overall just health of the skin. Um, Intrinsic aging, or things that you cannot control, would be things like menopause. So your decrease in estrogen during menopause can cause a loss of collagen. your ethnicity, so related directly to like the pigment in your skin. So, like I had mentioned in the slides before about the Fitzpatrick scale, so if you were on the higher end of the Fitzpatrick scale, the 4, the 5, you are less likely to see photo damage at a younger age, so damage from the sun at a younger age, versus if you're on the lower end, so the 1s and the 2s, um, you would see more photo damage at an earlier age because you don't have that natural SPF in the skin. And even if you have a 4 or 5 Fitzpatrick scale, you have like a 2 or 4 SPF naturally within the skin, but it's, it's something versus not having it, being a 1 or a 2 on that scale. And glycation. So glycation has been a buzzword in the skincare industry in a lot of articles recently, which can cause inflammation in the skin. And what glycation is it's the sugars in your skin from things like carbohydrates and sugars that you digest, and it attaches to the proteins such as like collagen, and it actually will help, or will not help, it will, well, yeah, it'll help the aging process, which we don't want. And something called advanced glycation end products, or AEGS, cause inflammation within the skin. It is something that happens as we age too, so which is why it's an intrinsic factor where we can't really control it, because as we age it happens, but we can help minimize it by doing things like exercising. There was a study in 2018 that they had done about, or they tested 15 people, and they had them do aerobic exercises, resistance training, flexibility exercises, and it was proven to counteract some of the glycation process within the body. So, kind of staying healthy and making sure that we're choosing lower sugar diets and getting out there and exercising would be super beneficial to slowing that process down. So collagen is another huge buzzword in the skincare industry. We see it everywhere. Everybody wants more collagen. Everybody wants not lose their collagen. We want to have supple baby-like skin, which is great. And what collagen is it's a protein, and it's found in the dermal structure of the skin. So there is a picture of the chart of the skin. So there's the epidermis and the dermis. So it's in that second layer in the dermis. And as we age, our fibroblast cells slow down, in turn slowing down collagen production. Right? So those fibroblast cells slow down, they turn off, and then the collagen will no longer produce, or the production will be a lot slower. So it is regulated, collagen is regulated by protein digesting enzymes called MMPs. So MMPs break down collagen and elastin. So we do not want MMPs, or we want them as minimal as possible. And they are stimulated by UV rays, so the sun, aging, and all of that stuff. So again, we want to stay away from the sun as much as possible. So goji berry has been shown to help inhibit MMPs, which is great for aging skin, both internally and externally. I personally use some products that have goji berry in it. Not only does it smell amazing, but it really leaves the skin nice and supple and full, and just that nice extra glow. And studies have shown that healing the skin from the inside out and consuming collagen peptides daily can increase elasticity and repair collagen fibers. So I would say, as far as like supplements, that's again something that I would consult Dr. Medina with and do your research on, because not every supplement is created equal. I have seen a lot of clients that have come to me with, I'm going to say it, Amazon products, or things that are not verified or authorized retailers of certain products, whether that be topical skincare products, or, things like collagen or different vitamins and supplements. And you just want to be mindful of what you're putting in your body and on top of your body, and making sure that that is safe and what you need. LED light source provides compromised cells with added energy, so cell performance is enhanced. For example, fibroblast cells will increase collagen and elastin production in connective tissue. So the picture in the middle is a woman laying with a Soluma LED light therapy panel over her face. So the Soluma panel is FDA approved to help with the production of collagen, elastin, to help with wound healing, and even in some cases, pain management. Um, I personally love this treatment because you see lasting results. As this bottom picture shows, this is a before and after of a woman who was using or went through treatments 3 times a week for 4 weeks. And the picture was actually taken 12 weeks after the series. So it shows that, it's continuing to work. It is suggested that when you go through a treatment like this, that it is done in a series 2 to 3 times a week for at least 4 weeks. And then after that, going through a monthly maintenance. All right. And so my third point would be a proper skincare regimen, which is super important to the overall health of your skin and maintaining that, or even correcting some issues that we might have that we want to get rid of or try to improve. So, knowing your skin type when choosing products is super important. Um, a lot of my clients sometimes don't necessarily know what their skin type is, and that's totally okay. I don't expect you to know that. That's what I'm here for. But when you are looking at skincare products, because there are a astronomical amount of skincare products out there that can be so confusing, it's important to have a guideline, right? Especially when you're walking into like a Sephora or an Ulta and you get help from somebody, they might not know your skin type and ask you. And if you give them an answer that isn't correct, then you might be purchasing products that are not right for your skin. A question that I like to ask my clients is, does your skin get oily before or after lunchtime? Typically, if your skin is getting super oily before 12:30, 1 o'clock, you more than likely have oily combination skin, just depending. After that would be more towards like combination, dry skin, or if it doesn't get oily at all. That's, another point to try to figure out. Before doing a full skin analysis with a magnifying lamp, I try to ask a lot of questions to get down to figure out what your skin type is. Changing your skincare regimen as the seasons change is important as well. In the winter months, you might want to add some hydrating products because as it gets colder, our skin tends to get drier. And we're going to want to add hydrating products because you might get, if you have eczema, it might flare up as the seasons change. Same thing with rosacea. And then in the summertime, maybe mixing your moisturizer with your SPF to help with, your oil production. Because in the summer months, if you're in a humid climate, your skin might get a little bit more oily than it normally does. And just adjusting that and being aware of that. I try to teach my clients to be able to make those decisions without asking me. Of course, I'm always here to answer any questions that you have, regardless of how many times I've seen you or told you. But if to be able to educate my clients to be like, okay, I'm gonna need to add this because my skin's feeling a little tight, or I'm gonna take this out to try to address this. The education is golden, especially when I can't go with you to every Sephora or Ulta, or when you're looking, even for makeup for that matter. So knowing the proper amount of each product being used is important as well. If you're using too much or too little of a product, it might not be the right product for you. So this picture that we have here is a pretty good illustration of how much of each product you should use. Um, so like, I've had clients say, "I'm going through an entire bottle of moisturizer in a month." Okay, so we're probably gonna need to switch that, add a hydrating toner if we don't already have one in there. Um, a cleanser, same thing. If it's you don't feel like your skin is being cleansed, then maybe we need to play with that. Different things that we might need to play with in order to get your ideal skincare regimen. And again, it won't always feel like you might have to change it, I always tell my clients to date your skincare, don't marry it, because our skins change. So, the seasons change, we get older, we're in different environments, and those are all contributing factors when choosing your skincare regimen or even your treatment, such as facials and things like that. So, the ideal skincare regimen would be to cleanse, tone, correct with serums, moisturize, and then protect with things like sunscreens. Um, so the first step would be to double cleanse, especially if you are a daily makeup wearer. I cannot stress this enough. So when I personally love oil-based cleansers, even though I have more oily, acneic skin. Because oil-based cleansers, if it's the right oil-based cleanser, it will adhere to the excess oil, makeup, dirt, debris, and emulsify and remove it, before you go in with your cleanser to address your skin type. Now, if you're not double cleansing and you're wearing makeup, you might come across where, if you ever dry your face with a white towel or a lighter colored towel, you still see makeup on your towel. You're gonna need to go in with another cleanse. And it doesn't allow that the cleanser that you're using to cleanse your face to actually do its job. So if you have pigmentation and you have a cleanser with vitamin C or glycolic in it to help brighten your skin, then and you're not double cleansing, it's not able to do its job because it's trying to break down that makeup, that dirt, the excess oil, or whatever is laying on top of your skin. Um, it Oil-based cleansers are great for a first cleanse or a somewhat of like a foamy cleanser to remove makeup. Makeup wipes, I'm gonna say, are not my favorite. If you are absolutely exhausted and you can barely take off your shoes to go to bed, okay, using a makeup wipe in that case would be okay. Um, but makeup wipes tend to really aggravate inflammation in the skin if you have inflamed acne, pustule, like those big whiteheads, rosacea, eczema. It can really aggravate those skin conditions. And even if you don't have those conditions, just the pooling of on the eye and the skin in general, I would just avoid it if you could. And going in, like I said, with an oil-based cleanser or a foamy cleanser. I will say that oil-based cleansers are a learning curve, especially if you've never used one before, but once you get it down, you will never go back, because if I'm wearing, like, theater makeup, I'm talking, like, full face, waterproof, which is rare, but I can get it all off, and I know that my face will be completely clean to be able to, allow my skin to absorb the products after. So exfoliating is the next step that would only 1 to 3 times a week, depending on your skin type. Exfoliating 1 time a week would be more for your drier skin types. The 2 to 3 times a week would be more for your oily skin types. And there are 2 forms of exfoliation. We have chemical exfoliations, which would be like your acids, your salicylic, glycolic, retinol, alpha hydroxy acid, beta hydroxy acids, and then your mechanical exfoliations, which would be your like Clarisonic brushes or a washcloth or even little like the exfoliators that have the granules in it. That would also be a mechanical exfoliation. Microdermabrasion would be a form of mechanical exfoliation in a professional setting, or like a hydrofacial and things like that. And then after you would exfoliate, you would want to tone your skin to balance the pH levels within the skin and set the skin up for best product absorption. So there are different toners out there. Mainly, there are astringent toners, which are like your alcohol based toners, to degrease the skin, and then your hydrating toners. So your astringent toners would be more for your acneic skin types, I would only really use those when I'm prepping skin for something like a chemical peel or microdermabrasion or an advanced exfoliation, not necessarily on a daily basis because it can strip your skin of its natural oils. I really love using a hydrating toner for all skin types, including oily or acneic, because, like I said, it does set the skin up for best product absorption. So I like to explain to my clients that your skin is like a sponge. And if you've ever let a sponge sit out after you've done the dishes and it gets really hard and dry, and then you try to run it under water, it takes a little bit longer for it to absorb that water. Versus if it's a little damp and then you run underwater, it will suck up the water pretty fast. So same thing with your skin. You want to set it up to absorb the next step, which would be your serums. So your serums are going to correct skin conditions, right? So a few slides ago, I talked about your skin type. So your skin type would be dry, normal, oily, or combination. Skin conditions are things like acne, hyperpigmentation or dark spots, lack of hydration in the skin, rosacea, eczema, psoriasis. So serums are going to correct the skin conditions. And serums can probably, and most of the time are, the more expensive product out of your regimen, which is another reason why you want to make sure that you are prepping your skin to absorb it so that you're not using more than you need to. Um, because I mean, who wants to like throw away a bunch of money if you don't have to, right? A toner that I love using is the picture on the top right. It's a cucumber hydrating toner. It has heavy water in it, hyaluronic acid, and probiotic in it to help with the healthy bacteria in the skin. And then the second to last thing would be your moisturizer. Moisturizers are important to keep your skin hydrated, to lock in everything that all the work that you did through your regimen. Even oily skin needs moisturizers. There are oil-free moisturizers, and again, I can help you find a moisturizer that's gonna fit your skin. It can be frustrating, I know, me being myself having oily skin, putting a moisturizer on and feeling like it's just gonna make my skin oily, going back to knowing your skin type and figuring out something that's gonna work for your skin. Because we might be using products that are not necessarily beneficial for our skin. Um, Also, when choosing a moisturizer, as Dr. Medina had talked about, when dermatologists, when they prescribe steroid cream or antibiotics for things like antibiotics are typically prescribed for like acne, and then steroid cream is typically prescribed for, or like retinols for like anti-aging, and they're a pretty high percentage. Um, they'll prescribe very gentle moisturizers. Um, and they won't necessarily do anything bad for the skin, but they also won't do anything to improve the skin, which is why they prescribe those in conjunction with their antibiotics and steroid creams. So you want to figure out that sweet spot of finding a moisturizer that's going to help you with your skin type and even conditions, with not contraindicating with anything that you might be already prescribed with, even if it's not a dermatologist, thyroid medication or different drying prescriptions that can dry the skin. And last but not least, your sunscreen. So throughout this slide, I had talked about how the sun and UVA and UVB rays can affect the skin. We saw that picture of that gentleman who was severely aged on one side of his face versus the other from the sun. So my biggest thing is sunscreen always. If you wake up in the morning and you're gonna go to the gym and you don't wanna wash your face and use all the products, I get it, but put a sunscreen on because you need it. Even if the sun isn't out and it is cloudy and gloomy, I mean, I'm sure all of us have experienced at one time or another going to the beach and it's pretty gloomy. You don't put sunscreen on. The next day you're burnt and you're like, how did this happen? No sunscreen. I tell people it's like an ex, okay, guys? You might not see him, you might not even feel him, but the sun is always there. Unless you're, like, in Alaska or something, then, yeah, maybe not. But and you the sun doesn't come up, but wear sunscreen always. The only time you wouldn't is if you are going to sleep and, you will be in your bed and you will not need sunscreen, so to just end with a moisturizer. So I kinda went over, different things, lifestyle choices, and how they affect our skin, anti-aging factors, and how LED light can help rebuild collagen and turn on those fibroblast cells, and skincare products and what products, how to choose your skincare products. And yeah, so thank you for joining us. I am offering a complimentary consultation and then 10% off the first service booked within the next 24 hours of this webinar. I do have a booking system that I use that you can find on my website at seeingbeauty.com. And if you would just mention the attendance of this webinar in the notes when booking so that I can go ahead and apply that discount. Um, and my Instagram handle, Seeing Beauty, it's the easiest way to stay in touch with what I've got going on, see the new treatments that I'm performing on my clients, and I always put like just fun tips and tricks and things like that. But thank you.
All right. Thank you. That was a lot of information. Hopefully everybody enjoyed that and got some good tips out of it. Again, our offers are for the next 24 hours. Definitely contact Merissa, contact myself. And let's see, we do have a couple questions that came in. I know we're running a little short on time, so we'll run through these. Most of these are going to be for you. Do you see the questions there, Marissa,
I
that came?
do. Thank you.
Okay, perfect. So go ahead and start.
Okay, so addressing the supplements, and yes, supplements are huge in the beauty industry. And I would say you would want to look more as an authorized retailer. This goes for supplements and skincare products. So I personally have had a client who purchased a moisturizer, the same brand that I retail in my studio, and she had bought it on Amazon, and she said the consistency was off. Um, and I had her bring it in, and I looked at it, and it smelled different. It looked different. So I actually sent it to the skincare company. They had their lab test it, and turned out it was conditioner. Um, and it was a traumatic experience for both myself and my client, but just making sure that what you're getting is the actual product itself is huge. That can be, like I said, supplements and skincare products together. Looking at I'd say organic is definitely a good place to start as far as supplements go. Looking at the first few ingredients on the ingredients list is important when looking for supplements. I'm sure Dr. Medina has a few good recommendations as far as supplements. I get my supplements through him, especially my vitamins, because I've tried different vitamins such as like vitamin D and stuff, and I personally I don't like just this random generic stuff. I trust him with my supplement needs. Um, as far as sunscreen goes, organic sunscreens, so the word organic in the skincare industry is very, I'm gonna say light. The FDA doesn't regulate the skincare products as much as I say I would like to, but definitely looking for active ingredients in sunscreens. You're gonna want to look for zinc. Yes, zinc is amazing. The only thing about zinc is that it tends to have a very thick like consistency to it. So your higher Fitzpatrick 4 or 5, it doesn't blend to the skin very well or can look pasty. Titanium oxide is another ingredient that you want to look for. It's a little bit less thick, but there are tricks to it, like spraying a toner, a hydrating toner, then your moisturizer, mixing it together. It will not dilute the SPF, but it is easier to apply. Um, and the oxide word at the end is something you want to look for when looking for sunscreens to protect you. Um, Another thing is broad spectrum. So the word or that phrase itself means that it protects you against the UVA and the UVB rays. So the ones come directly from the sun versus the ones that penetrate through the glass. And when the sun is not necessarily present, that will still go through. You want something that protects you against both. And yes, so Korean skincare, the 10-step programs are super popular. And I will say there are some good Korean skincare lines out there. I'm not 100% familiar with all of them because it takes a lot to translate the ingredients, um, because I don't speak it. So one thing that I do take into consideration, like vitamin C, for example, can be shown in on the back of a product on the ingredient list in like 5 different ways. The most common way is L-absorbic acid. And same thing with like vitamin B, vitamin A, or derivatives of vitamin A. Um, so I'd say that they can be very good. But just to be mindful of it, and if there's a specific product that you want me to look into, I'd be more than happy to look into that. As far as the 10-step skincare systems that some Asian countries use, I definitely think that having a good solid skincare regimen is important, but if somebody is going from not even cleansing their face or just cleansing to introducing a full skincare regimen, I am definitely going to suggest that you start with 2 or 3 products at the maximum and then slowly introducing products. Now, there's a few reasons for that. One of them being that you more than likely aren't going to use a 5-step program if you're not used to cleansing your face or doing even one step. Most people will just put it in their medicine cabinet and then be like, oh, yeah, that was a good idea for like a week, and then I forgot about it. I mean, I would be the same way too, right? But introducing like 1 or 2 steps into your daily skincare regimen and then slowly increasing that, you're more than likely to stick to a routine. Another reason is because if for whatever reason you have an allergic reaction to a product, it's easier to figure out what you are reacting to. So, especially when I work with people who have like inflammatory issues such as rosacea, acne, eczema, or even my oncology clients who are going through treatments, there are different things that change with that. So only introducing a few products at a time and getting your skin used to it. It's like working out your skin, right? You're not going to go and try to pick up a 100-pound dumbbell and think that you can curl it. We're going to start slow and progressively exercise our skin to be able to use a full skincare regimen. Um, and I think that answers those questions.
There's a question about essences. Are you familiar with what that is?
No, I'm
Okay, me either. All right.
anything else?
No, that's not it. All right, cool. That's pretty much all our questions there. I have a quick one as far as makeup goes and brands. What's your thought on makeup? Does it flare up the skin? Does it make it worse? Are there brands you want to focus on? What are your thoughts on that?
So makeup, I'd say specifically towards acne, there are a list of ingredients, which I can also attach in the email with the copy of this recording, um, that you want to stay away from. That can be like a buzzword is comedogenic, so it can feed acne causing bacteria.
Mm.
And I recently went through my makeup to look to see from anything from a lip product to an eye product to face product, to see what products had these at least 1 or 2, and almost every single one of my makeup products had at least 1 ingredient in it, which is kinda scary. So I have switched to mineral makeup.
Ah,
It doesn't necessarily absorb into the skin. That's another reason why I would say double cleansing is huge, or cleansing before you even work out is huge, because when you work out, you tend to sweat. Your pores would, or the sweat like will dilate your pore a little bit, and then whatever is sitting on top of your face, even if it's not makeup, will go into your skin, and can cause a breakout. There is a brand that I have recently fell in love with called Advanced Mineral Makeup, that was created by an esthetician, and I have seen tremendous results with my acne clients, being able to use a full coverage makeup that didn't harm the skin. And there's different mineral makeups out there. I've tried a few, and some of them I like. I'd say the coverage of mineral makeup is something that you have to play with. But yes, makeup can cause flare ups. Even in my rosacea clients, I have seen flare ups in makeup. To try to keep it to a minimum or be mindful of what you're putting on your skin.
Nice. Awesome. Yeah, one of our listeners loves mineral makeup. She's all about it. All right, perfect. So we're a little over time, but we want to thank everyone again for joining us. Again, we'll be sending out the recording of this webinar for you to have and share and rewatch, because I know there was a lot of information that we both offered. Any closing remarks, Merissa?
No, that's it. Thank you everybody for joining us.
All right. Don't forget about our special offers, and thanks again. Bye bye. Good night.